Coronaviruses are a group of viruses that can cause diseases such as colds, severe acute respiratory syndrome, SARS, and the Middle East Respiratory Syndrome, MERS. A new type of coronavirus has been discovered after it was identified as the cause of the spread of one of the diseases that started in China in 2019. The virus is now known as Corona 2, SARS-CoV-2. The resulting disease is called coronavirus 2019, COVID-19. In March 2020, the World Health Organization announced that it had classified the 2019 coronavirus COVID-19 as a pandemic. Public health groups, such as the Centers for Disease Control and Prevention in the United States, CDC, and the World Health Organization, WHO, are monitoring the pandemic and posting updates on their websites. These groups have also made recommendations about disease prevention and treatment. Symptoms: COVID-19 signs and symptoms may appear 2 to 14 days after exposure. The period after exposure and the time preceding the onset of symptoms is called the incubation period. Common signs and symptoms can include fever, coughing, tired. Other symptoms may include shortness of breath or difficulty breathing, muscle pain, chills, sore throat, losing a sense of taste or smell, headache, chest pain. This list is not exhaustive. Other less common symptoms have been reported, such as rash, nausea, vomiting, and diarrhea. Children usually have symptoms similar to adults, and the severity of their disease is generally mild. The severity of symptoms of COVID-19 can range from very mild to severe. Some people may have only a few symptoms, and some people may have no symptoms at all. Older people or those who already have medical conditions, such as diabetes, heart and lung disease, obesity, chronic kidney or liver disease, or a weakened immune system, may be more likely to develop severe disease. This is similar to what happens with other respiratory diseases, such as influenza. Some people may experience worsening symptoms, such as worsening of shortness of breath and worsening of pneumonia, about a week after the symptoms begin. When do you visit the doctor? If you have symptoms of COVID-19 or have had contact with someone who has been diagnosed with it, contact your doctor or clinic immediately for medical advice. Before going on schedule, tell the healthcare team about your symptoms and the possibility that you have been exposed to the virus. If you see signs and symptoms of COVID-19, seek care immediately. Common signs and symptoms can include difficulty breathing, a persistent feeling of chest pain or pressure, inability to stay awake, mental confusion that was not there before, lips and face turn blue. If you have signs or symptoms of COVID-19, contact your doctor or clinic for instructions. Tell your doctor if you have other chronic medical conditions, such as heart or lung disease. During a pandemic, it is important to ensure that health care is provided to those most in need. Corona symptoms. Unusual. The reasons infection with the emerging coronavirus is virus, scientifically called the severe acute respiratory syndrome virus Corona 2, or SARS-CoV-2, leads to coronavirus 2019, which is referred to briefly as COVID-19. The virus appears to spread easily among people, and scientists will continue to discover more about how it spreads. The data showed that it spreads from person to person through close contact within 6 feet, or 2 meters. The virus is spread by respiratory droplets released when the infected person coughs, sneezes or talks. This spray can be inhaled, or entered the person's mouth or nose. It can also be transmitted if a person touches a surface on which the virus is infected and then touches its mouth, nose, or eyes, although it is not considered the primary mode of transmission. Risk factors. COVID-19 risk factors seem to include recently residing in one of the areas that has witnessed a constant local spread of COVID-19 or a recent arrival from a trip to those areas. according to the areas defined by the Centers for Disease Control and Prevention (CDC) or the World Health Organization (WHO). Close contact, within 6 feet or 2 meters, with a person with COVID-19 for more than 5 minutes, or coughing or sneezing of a person with this disease. Complications. Although the symptoms of most people with COVID-19 range from mild to moderate, the disease can cause severe medical complications and lead to death for some people. Older adults or those with chronic medical conditions are more likely to develop a serious condition than COVID-19. Complications can include pneumonia and breathing problems, several organ failure, heart problems, an acute pulmonary condition that lowers the amount of oxygen coming through the bloodstream towards your organs, acute respiratory distress syndrome, blood clots, acute kidney injury, additional viral and bacterial infections, children's multiple system inflammation syndrome, MIS-C,